We are having a symposium with MedMine. It's an electronic surveillance system that is used by infection preventionists to monitor infections in hospitals, to look at trends, to look at any type of thing that may be going on related to infections in hospital-acquired infections, community-acquired infections, and it helps to streamline their processes.
Blue Cross has provided a grant to MedMine to help support the facilities to implement the software that is needed for tracking infections.
Tell us, how serious a problem is infections in hospitals in Louisiana?
Infections are very widespread among the hospitals and cause multiple readmissions to the facilities, and therefore we have at least 26 facilities represented here today to discuss their implementation of the software as well as their experience.
And how does the software work?
The software is a tracking mechanism. It looks at the different types of infections. It can narrow it down into the unit that the infection is on, as well as the type of infection, down to the room even where the infection came from.
And how is that information utilized then?
That information is utilized by the infection control unit within the facility, and they are able to pinpoint the infection and put corrective action into place and educate the staff on how to decrease those infections.
What kind of response have you had from the hospitals in Louisiana that are taking part in the program?
It's been very positive. They've been very happy. They've seen a decrease in their days where the patients do not have to stay longer. It's decreased the complications in the facilities, and so they've had a very positive reaction.
How has it worked at the Baton Rouge General?
It has been amazing. It has been amazing. We are like most infection control departments. We have limited resources, and it is amazing. We were doing everything manually, and now MedMine has streamlined all of our processes so that what took us weeks to do now just takes days. We can do real-time infection prevention, we can do real-time investigations of infections, and we can prevent future infections.
What potential does this program have?
I see it has an incredible potential. With public reporting, we have so many more types of infections that are now publicly reported, that are mandated to be reported. We go through the Centers for Disease Control system, NHSN. MedMine actually makes that very easy. It just basically, it's a push of a button and it goes to the CDC, and you've got your data to be publicly reported, so we don't have to enter data manually. I see it expanding to that for surgical site infections, for basically every infection. Instead of just a few, and we have to focus our efforts on just a few, we can look at so much more, and we can help our patients so much more.
MedMine has been truly a remarkable experience. It has lightened my load tremendously. I went from looking through cultures 4 hours a day to running a report that takes me approximately 30 minutes. And it has lightened my load. I'm able to better find the infections if they're already in the hospital and able to investigate each one.
Just how serious a problem is it for infections in hospitals?
It's very serious. Not only lives are at stake, but also the incentive programs. We'll lose money if we have what's called a never event, and we have infections and we won't get paid for the treatment of them.
What's the potential for this program?
The potential is limitless. It helps, instead of having to have two people do a job, you only have to have one person.
The name of the program is MedMine, and it's worked great. It allows us to not have miss any of the infections throughout the hospital.
What kind of potential do you see for this program?
The potential is limitless. We are able to, like I said, not miss any of the infections that before might have fell through the cracks.
I've been involved with MedMine and Blue Cross Blue Shield with an initiative for improvement, and it helps us to stay focused and to reduce the targeted infections that we're looking at, like central line associated bloodstream infections. And it really helps us to network with other people who have done things in other facilities across the country. So it really gives us ideas to take back for quality improvement.
This program has allowed us to be able to pull data from our current database into a program that allows us to quickly analyze what's going on within our hospital.
And what potential does this program have?
It has the potential to help allow me to have more time to be out on the wards, providing interventions to prevent infections.
We've been able to utilize the program to spend more time preventing infections and less time identifying them after the fact.
What type of potential does this program have for your hospital?
It has the potential to decrease the time spent in the office for the infection preventionist and allows them to spend more time on the floor with the patients.
Blue Cross Blue Shield is focused on improving the quality of care of our members as well as the patient safety.
Are you excited about the potential of this program?
I am, but just for facilities to come together and share best practices always helps you to do better when you go back home and you bring that excitement with you. So we're looking forward to that.
What's your reaction to Blue Cross's involvement in this project?
I think it's exciting for an insurance company to put together funding and realize that they have to really buy into that prevention and not just wait to see if something's going to happen. I think that's very exciting.
I greatly appreciate Blue Cross Blue Shield for providing the grant to allow us to utilize this program, and I especially like the symposiums that they have been providing because that has greatly helped me to improve on interventions.
What's your reaction to Blue Cross being involved in this project?
I think it's a fantastic idea. We never had an electronic surveillance system before, and by allowing us to apply and get that grant, we've shown our administration that we can streamline our processes. So by Blue Cross helping with that, we've been given the opportunity to use a system we may never have been given that opportunity to use before.
I think it's wonderful. I think it has been a wonderful thing, and I hope they continue with the process. And if not, we will definitely keep MedMind because it is a great product.
We are very happy and very excited about their involvement to increase the quality of care that we're providing to the patients.
Blue Cross Blue Shield of Louisiana is here to support them in any way, and we are here to help them with anything they identify that is needed.
If people have questions or like more information, what should they do?
They should go to the website, Blue Cross Blue Shield of Louisiana, www.bcbsla.com.